What's more reliable for managing your blood sugar? HbA1c or time in range, TIR? Here's the quick answer. HbA1c gives you a 3-month average, but it can be misleading. TIR shows how stable your glucose is, day by day. So if you're using a CGM, TIR is often more useful for real-life decisions. But don't throw HbA1c out just yet. Let's break it down in detail. What exactly is HbA1c? HbA1c, also called glycated hemoglobin, measures the percentage of sugar-coated red blood cells. Since red blood cells live about 90 to 120 days, HbA1c reflects your average blood glucose level over the past 2 to 3 months. For example, an HbA1c of 7% corresponds to an estimated average glucose, EAG, of around 154 mg per deciliter. It's been the global standard for diabetes management for decades. Doctors use it to assess treatment effectiveness and long-term risks. But here's the problem: it's just an average. It tells you nothing about swings, spikes, or lows. And for many patients, that's a dangerous blind spot. What is TIR and how does it work? TIR stands for time in range. It measures the percentage of time your glucose stays within the target zone, typically 70 to 180 mg per deciliter. This data comes from continuous glucose monitoring, CGM, devices, which track your glucose 24/7 in real time. Let's say you wear a CGM for 2 weeks. If your glucose stays between 70 and 180 for 70% of the time, that's roughly 17 hours per day spent in a safe range. Unlike HbA1c, TIR reveals the ups and downs in your day. It helps you understand how food, activity, stress, and medication affect your glucose in the moment. It's a game changer for people who want to fine-tune their lifestyle. Comparison. Same HbA1c, different risks. Let's take 2 people with an HbA1c of exactly 7%. Person A's glucose stays steady, between 90 and 160 mg per deciliter all day. Person B swings from 45 to 250 mg per deciliter multiple times a day. Same average, but completely different stories. Person B has a much higher risk of complications. HbA1c hides that. TIR exposes it. That's why many experts now say, TIR complements HbA1c, and might be even more important in day-to-day care. Limitations of HbA1c you may not know. Besides masking glucose swings, HbA1c can also be inaccurate under certain conditions. For example, people with anemia or kidney disease. Those with different red blood cell lifespans. Pregnant women or certain ethnic groups. In these cases, HbA1c may show falsely high or low values. That could lead to wrong treatment decisions. TIR, on the other hand, doesn't rely on red blood cells. It directly reflects your glucose levels, minute by minute. Benefits of using TIR in daily life. So, what makes TIR so valuable? It gives you actionable feedback. You can see how specific meals, exercise, or sleep patterns impact your control. More importantly, studies show that increasing TIR is strongly linked to lower risk of diabetic eye disease, kidney damage, nerve problems. Even a 10% increase in TIR can make a meaningful difference in your health. It helps you improve outcomes before complications arise. Real case. A CGM user's HbA1c versus TIR. Maria has had diabetes for 8 years. Her HbA1c was 6.8%, a great result on paper. But she often felt dizzy and shaky in the afternoons. Once she started using CGM, her TIR was only 54%. Turns out, she had frequent unnoticed lows. Thanks to TIR data, she adjusted her meals and medication timing. Her TIR improved to 78%, and the symptoms disappeared. HbA1c told only half the story. Final verdict. Use both, but prioritize this. HbA1c and TIR are both important, but they serve different purposes. Use HbA1c for long-term tracking and comparing trends over months. Use TIR for daily decisions, safety, and lifestyle optimization. If you're using a CGM, focus on reaching at least 70% time in range. That's the recommended target for most adults with diabetes. Combine both metrics for a full picture of your health. And always talk with your doctor before changing treatment plans. Let's summarize. Know your numbers. Track your patterns. And choose the tool that helps you live well every day.